Hi everyone, welcome to the Life of Education podcast. We're here today with Dina and Jane from Little Feather Collective. Yes, I got it right.
You did.
Thank you so much for coming today, guys. Maybe you can introduce yourself and what you guys are all about.
Sure. Go ahead. Thank you. I'm Jane Rushworth. Hi. I'm a doula here in Dubai. I'm also a childbirth educator. I suppose that my thing is more postnatal. So I like to support women postnatally with their breastfeeding journey if they have any issues. And provide care, sort of wraparound care for women when they've come out of hospital and they've just had their baby here.
Nice. Dina?
My name is Dina Gandour, and I'm also a doula with Little Feather Collective, but mainly teaching yoga at the moment, prenatal yoga, regular yoga, meditation, relaxation, all those great things. Thanks for having us.
So one of the reasons that we wanted to have you guys on is obviously to talk about what it is to be a doula and what does a childcare educator mean? Sorry, did I say that right?
Yeah, that's fine.
Okay,
Yeah. I mean, we have different titles for. So in the UK, I probably would call myself antenatal educator, antenatal teacher. Here, the antenatal word is not so battered about. We say prenatal educator, childbirth educator. I think it's probably a little bit more global.
What does that mean when you're an educator of that
An
sort?
educator of childbirth in all its glory. So when a woman finds out she's pregnant, so she will almost undoubtedly start pressing Google and find out everything that she feels like she needs to know in those early days. We offer childbirth classes, or I've offered classes over the years to support her and her partner if she wants to just find out and explore all the avenues for choice leading up to her birth, I would say. So it's about finding out what information is out there, what she needs to know, what she thinks she doesn't know yet.
So what information does she need to know?
Well, they always say, I don't know what I don't know yet. I don't know what I need to know. Tell me everything. Because I would always start my classes with kind of a bit of an agenda setting, asking, come on, guys, so why are you here? Why do you want to be here? And they say, well, we don't know anything. We don't know anything. We have come so far removed from women supporting other women in their family setups, in their village setups, where other women would have just supported and told other women
that would have
what
been
it was
passed
like.
down in some way at some point. Yeah, that's a really good point. And I think when I started becoming interested in becoming a doula, I was actually pretty shocked at how much as a woman I just didn't know about my own body and how it works. And at some point, not all of us, but some of us might decide to go on that journey, and to not know anything is really shocking. Like at what point did we just decide we weren't going to tell anybody anything? Like,
Don't
it's
tell
a big
them.
secret.
It's a big secret. It's true.
But it's
really
so
true.
important. It's natural. It's normal. It's physiological. Why don't we all know this?
Well, I suppose there are different reasons why we don't know it, or why women don't know it.
Yeah,
it's because we now live so very differently. So even over the decades, I've been teaching classes for almost 20 years. I started training when I was pregnant with my second son, Harvey, and he's now 20, so about that time. And my eldest is 21. I went to classes, I didn't ask my mum, my sister, or, those tell me about it. They live in different places. But I suppose the world is now, it's very disparate. We live so true. Unconnected to our family and our, I don't know, maybe close friends do share the secrets. Maybe they don't. Maybe they think it's like you have to find out for yourself because it's a right.
I had to do it. You have to do it.
Well, it's different here, isn't it? Because when you move to Dubai, you don't have a backbone.
That's exactly it.
I was going to say that. Yeah, definitely. I was going to say it's a bit like living in London, actually. That so we don't live very close to our parents.
Yeah.
or family, friends.
And how long does it take you to build a circle of people that you can trust that deep? If you move to any city, not just
exactly. Yeah.
That's true. And you might be in a circle of people that you really love, but they might not share the same value. Like at that moment in time, they're the right people that you want to be around, but they might not share deeply the same values as you, or the same outlook or the same perspective.
So childbirth classes can be a great opportunity for a group of couples or singles to come together and in a safe place not feel like they're foolish by asking any, am I going to ask a stupid question? And they can share that with each other, because you can sure as damn it know that everybody who's sitting in that circle is wanting to hear the answer to that question, or even ask that same stupid question.
So is that what a doula is, the person who leads that class?
Not necessarily. So you could be a childbirth educator without being a doula, I think. Yeah, you could.
But part of the role of a doula is to make sure that you are including childbirth education in your sessions with your, the parents or your client or whoever you're working with. So like it's a one-on-one relationship that you have, that you hire a doula on for this certain period of time, and what's included in that is usually 2 prenatal or antenatal sessions, and those are where you can come in and do all the education parts. So to answer your question, you're talking about, okay, so here's how your body changes during your pregnancy, here's how your body progresses and the process of your birth, and here are all the different options that you might want to think about. Have you thought about what you want your experience to look like, feel like, include, who do you want to be there?
And these women may not have even considered this yet.
Yes.
So these are like, oh, blimey, have I got to think about this now? Who do I want there? Is there a choice? Do we have choices?
Yeah.
And
I didn't know my body did that, or I didn't realize that if I did that, that would impact all the different hormones happening in my body that are trying to, do this one thing, bring a baby out into the world. So part of that is the education. Part of that then is being at the birth if they choose to have you there, which usually after building that very, intimate relationship, they do kind of want you there to support them through, massage, through relaxation techniques, helping them with movement, positioning, and then being there afterward as well. So it's about like 2 sessions before, being present for the birth, and then 2 visits afterward, which Jane was kind of talking about earlier, making sure that they're, healing okay, that the feeding's going okay, sleeping's going okay, mental health, the relationship of the couple, the relationship of the new dynamic of having a new human being into the mix, and it can really go in any direction.
So as a doula, we might only offer a couple of classes. Yeah. If we're running antenatal sessions, that's differently. So we might offer 4 or 5 sessions that people could come along to. But as a doula, a couple of sessions. But the relationship that is building over that time is the most important thing, isn't it? So even though you might only pop and see them at their home for those 2-3 hour sessions or something, the communication that we keep going with the couple or the mother is really important over those weeks and months, because for the trust element is really, really important for women, for alleviating fear.
Yeah. Just having you guys there, I'm sure, is a big help, just to know that there is a number you can call if things are down. How did you 2 get into that? What was it that steered you both down that route?
Well, for me, it was probably a natural progression after having my first children, so back in the UK, and I was steering out of my current career and probably just moving into something different. So, and I think because I had a great experience myself and had great, so I had great experience of meeting other people through antenatal sessions and good birth experience. So I think.
Did you have a home birth?
Not with my first. So my eldest son Charlie was born in the Chelsea and Westminster in London, and then the other 2 were both born at home. Yeah.
Tell me what's a home birth like?
So I was going to say it's pretty much the same as having your baby in hospital, but I think the difference about having your baby at home would be that it's your space. So you govern what goes on in your space. And when a woman's having her baby in hospital, we always talk about environment and how important environment is. And the trust and the safety aspect is really important. So we're always talking about raising the oxytocin in the room and how we can do that. The oxytocin is the big, beautiful hormone that makes the uterus contract and makes labor progress. Adrenaline is the antagonist of oxytocin. So we try and need to keep the adrenaline at bay in the room, so we keep the fear out of the room and always try to increase the oxytocin. So imagine if you're in your home space, your own environment where you can do whatever you like. You don't need to ask permission from the midwives that are there that are supporting you.
There aren't random people walking in and out. There isn't like a beeping
but of course
thing, and
hospitals are not exactly. I was going to say the lights. Hospitals are not conducive to making you feel chilled.
It's true, and we talk about this a lot. So because here in Dubai there isn't an opportunity to have a home birth, so it's women have to have their babies in hospital. So we talk about that transition from being at home. So the environment at home, which you can dim the lights, you can have the best music on for you, you can eat what you like, you can walk around, you can get in and out of the bath,
wear your own clothes, bring your own pillow,
all those smells, those triggers which are really important. And then we're saying, so at some time you're going to have to make this decision to move to hospital. When is that going to be? And actually the guys are always saying, right, when do we go? At what exact point, how many hours in labour, exact point. So how many centimetres dilated can she be? And I'm like, well, how on earth are you going to know that? You're never going to know that. You have to take... you have to take the lead from her when she's ready to go. She will let you know when she's ready. But let's not rush it. If she's not ready to go yet, let's keep all the lovely oxytocin making stuff going on at home while you can. But of course, they've got to maybe navigate the Sheikh Zayed Road at 6:00 in the evening, or get there in the back of a taxi or in a car that he's maybe now driving a little erratically. So that is going to increase some adrenaline, don't you think? And maybe put a dampener on some of the oxytocin that has been created earlier on. And then she'll then enter the hospital where, you're right, bright lights, beeping machines, people asking her questions are going to have an impact perhaps on her dilating cervix.
Yeah, especially I think. So I spent a lot of time in hospital, and the one thing that I found being there is that people don't tell you what they're doing to you. They're just doing a whole load of stuff to you. And it's very hard when you're in your own space to step out of that and be like, what's happening? Oh my God, no, I have to, what is this? Do I want this? What are you putting in my body? What is this tube for? What is it? Do I need it? Is it important?
Yes.
And then having that, what were you going to say?
I was going to say, Dina, come on.
Oh yeah, I mean we talk about that all the time, and we actually call it like informed consent, where it's like, I'm going to inform you that I'm going to do this certain procedure, and you must tell me yes or no. Which is, we're sort of moving away from being, this sort of like bystander and allowing things. Allowing things to kind of happen to us without not knowing. And it's really important that, hey, okay, I'm going to be educated about what this procedure is, and I'm going to make a decision by myself or with my partner about whether or not it's what I want for myself and my body. Obviously if it's a risky situation, then yes, maybe at that point you're gonna have to trust the person in the room that's the authority, and that's the medical professional. But otherwise, you are allowed to say yes or no, and that's why the education is so important, because the knowledge is the power. When you're like, actually, I read and I know, because statistics have shown, and I've been signposted to evidence-based research from my doula, that this actually, isn't really necessary, or actually this might hinder the amazing physiological process that's happening with my body. So
we like to think that that we don't just say, oh yeah, we've got some great ideas about how birth should go, and that's how our opinion and how we feel it all should go, and everybody should have this kind of birth experience. But what I think we are really passionate about is women absolutely understanding the message that they're receiving from other health professionals, and really processing the information that they're being given, because we know sometimes that the information that women are given isn't correct. We know it's
or very biased,
or it's biased, or it's not up to date.
Yeah,
that's
what
the
would
difference.
It be biased towards?
Well, I can't speak for you guys, but I know when I was there, it was biased for me in one regard to like doing a procedure or to surgery or to something along those lines. That's what it was like for me. Not a birth surgery, but I'm talking about.
Yeah. So like the medical machine has its way of doing things, and it wants you to slide in.
Yeah, and I think it is difficult here because the care pathway for maternity care is consultant led. So in the UK, in Canada, in Australia, in lots of other countries, they have amazing maternity provision led by midwives who understand the physiology of birth, of normal birth.
So for the person like me who's going to be driving the car down Shakeside Road, has no idea about what's the difference between a doula and a midwife?
So a midwife is medically trained.
Okay.
So we're not medically trained. Okay. So, and we make that quite clear.
Yeah.
We're well educated in the anatomy and physiology and medical procedures. But we're not medically trained. So
we would never get involved in that process or give advice in one particular direction. No, we keep handing the sort of baton back to the couple and saying, well, this is the deal. These are the options. Now you go.
You have to make the choices.
Make that decision, discuss it with your medical provider or whatever. Yeah.
Sure. So you're like a mentor, advisor.
Well, even we say we don't advise actually. Right. So even that word is a little ambiguous.
Mm-hmm.
So this is how I see it in my mind. Maybe you can correct me if it's wrong, but it's like a doula would be somebody there to support you, to help you understand what you're going through.
Mm-hmm.
Is that
it's
right?
like a maid. It's like your maid of honor, but like for your birth. Like my first doula client told me that, and it just stuck with me because it's so true. Because we're kind of just there in the sidelines, being like, "You want purple flowers, girl? Like you go. Like you want a pink dress." Okay. Well, actually, studies say pink dresses aren't so good. So let's go back to maybe you want to think about going back to a different color. But we're that kind of person. It's like, hey, how can we empower you to remember your connection to your body, to remember, the power that you have within you, and to be able to go forward and make those decisions and those choices either as an individual or as a couple, feeling confident and feeling prepared. And feeling loved and feeling supported and feeling like you have options and just all those.
But I think things, also it's great for the supporting partner.
Mm-hmm.
So
that's a really good point.
For the guys, it is
so true.
It's true, isn't it? It's great for the guys because they then can find their voice in the birth room, because it's true, and we may be an advocate, but we're not a voice. We can't challenge the health professionals.
That's true.
In the birthing room, but the guys can ask questions of the health professionals and ask, what can you just repeat? Can you just explain that again to me? Can you make me understand a little better why this procedure might be necessary, or why we might have to move things on with some artificial oxytocin, or this kind of thing. And one of the things that we always say is like, well, if you can ask your health professional, be confident in asking questions. So, but we know how difficult that is, don't you think?
Oh my God, it's so hard.
It's true.
Like, I've told this story so many times, I'm sorry. But I remember being in hospital and having this moment where this surgeon was like, oh, we're going to now go in and fuse your pubic bone. And I was like, what? And I think I'd been in hospital like 5 weeks at the time. I was so drugged out and I was like, nah, like this isn't happening. And he was so shocked that I said no. And then he came back like literally an hour later with 2 more people and then 3 more people to try and convince me. And look, in hindsight, he might have been right. I might have totally been wrong. But that was my, I'm going to swear here, that was my choice to make. Like, I made it and I'm fine with that. I think I made the right choice for me, even though I think there was very, very valid reasons for them wanting to make that choice. And I think if I look at it very logically, I think he was right to a degree, but it just wasn't right for me. Does that make sense?
Absolutely.
But you understood the process.
Yeah, but I have a medical degree.
So you knew
so it was different.
What that meant. Yeah.
So it was
So I'm sitting here now going, oh, really? You didn't want to have that done?
No.
But I don't know anything about fusing of pubic bones.
But so the difference is that I had studied, so I have a Bachelor of Medical Science, not a medical degree, so just to correct there. And I had learnt enough about the human body to go, well, actually, I know this is really important for the symmetry of the pubic bone, blah, 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 but it wasn't what I wanted to do.
I feel like I need to find out more about that now. I'm fascinated.
We talk about this way too much. I'm sorry.
No, it's fine.
Sorry to
do it.
No, I'm fascinated.
It's
all important, isn't it? It's like,
definitely.
You got to bring it to the table.
When I had my accident, basically, I smashed this side of my pelvis and my pubic bone snapped off and my ilium. So all of it moved up here. And when they reattached my pubic bone, they put a rod through it and attached the pubic rami, so the superior pubic rami. And then it fused on its own. They eventually took, it was like a big pole. It was like that big. They took it out after because it was causing me like excruciating pain. And there's a little bit of asymmetry. I'm just going to put the microphone down, but it was like that on either side. And what they had suggested was to actually put a plate in the pubic symphysis and to fuse the right side and the left side, the whole thing. So to remove the
so one
cartilage.
side was higher than the other.
Yeah. So to remove the cartilage and to fuse the whole thing and to put a plate, and then he said like in a year's time you could get that removed, blah blah blah. When I heard that, I was like, no. And we had a huge like a really big battle there because there was a lot of medical professionals that were not supporting my decision to say no to this. And at the time it was like my husband was kind of like, you do what you want, like you do, like it's fine, whatever you decide. But he didn't know. And then everybody else in this medical machine, like it is a big medical machine, was like, you need to do this, eventually they gave up because I was very stubborn. And I got my way. Person? Yeah, so stubborn. And I got my way, and I didn't have it fused. And it's now I can tell you he was right because it's a little bit out of alignment. But I'm okay with that because I didn't want to have that type of surgery. I did not want to have my whole pubic bone fused.
Yeah.
And all, even now, like when I get to these decisions again about doing crazy things like that, it's like, no, actually, I'm going to choose a different route. But what I think is really interesting about what you guys are saying is the difference is that I was educated in what that really meant to do that. And because of that reason, I was so heavily drugged, but I could make a semi-conscious decision about what was right for me. And I know 100%, that he was very valid and he was right about the symmetry and about all of the points he was making, 100%, but it was not the right decision for me. And I am happy that I didn't do that. I don't know what I would be like now, whether I'd be better or worse, but either way, what I do know is I remember watching this documentary. I can't remember what it's called, but it has, who's that really famous talk show host? Ricky.
Yeah, The Business of Being Born.
The Business of Being Born.
That changed my life.
Me too. Yes. That
Ricky
is
Lake?
Yes, Ricky Lake.
Phenomenal.
Yeah, oh my gosh.
There's a moment in that
and
documentary.
Chilling and terrifying in equal parts.
There's a moment in that documentary where she talks about women, like the right to choose things is taken away from them. And I felt so much of that when I was in hospital too, that you don't have a voice as a patient and that people just do things to you and they do things to you. And you have to be so strong to stand up to that medical machine. And then if you've got someone on your back that's like, no, I'm here for you. I'm next to you. We're doing this together. Like, you're good. Whatever decision you make, I think it would make all the difference. That's just my 2 cents on the topic.
Yeah, absolutely.
What's that documentary about?
It's amazing. You need to watch this. It's
very much like US focused in the sense that, birth has become very business oriented in how the hospitals make money by giving, how much like of the dosage of drugs that they give, scheduling C-sections because women are living a really high-paced, work-centric in like lives, and just how hospitals and doctors, actually some doctors even get like kickbacks from like offering certain advice or giving certain drugs and that kind of thing, and just how the industry has become very much a business, whereas really you know, can go at home, you know, into your room and do it yourself without anybody. I mean, if everything is okay and there are no risks, et cetera, et cetera. But how it's very much like, no, you know, you need to come into the hospital, and you know, we need to give you these things, and you need to have this procedure.
So this is going back to what we said earlier about not having that information filtering through from our mothers and sisters and grandmothers, and so, you know, generations of women that are passing down their knowledge. So that is just instilling fear into women's, that little bit of part of their brain where they might say, yeah, but what if, you know, so women aren't believing that they're physiologically made capable to do this.
And I think the whole point is, though, that if a woman does choose to go have a C-section, that it's her choice, and it's because she's had an educated choice and an educated decision to do that. But that both options are available. Like
all the options.
You can do whatever you want to do. Like if you want to do surgery, you want to schedule it in because you got shit to do, amazing, that's great.
Absolutely.
Like more power to you, but that it's your choice.
I think it's just the idea that at some point we've just been removed from the process, and we forgot that we, you know, have a connection to our own physical bodies, and we now no longer trust our own decision, even if it means having a C-section or having an epidural or taking all the drugs that you ever wanted in your life. It's just like, oh, well, this person knows, I don't know. So therefore I trust this person to tell me what to do. And I think it's just reminding people, well, hey, actually, like, you can trust yourself and your decisions in the same way that you did with the decision not to go through that surgery. And then what? So what does that decision look like? How do you want to go forward from that space?
I think also at some point in that decision-making process, women aren't given all the information. That's the thing. And so when women are told that they're having a big baby, so they might have a scan. Dubai is great for scanning women during their pregnancy, throughout their pregnancy, probably more than anywhere I've ever known. At every appointment, a woman would have a scan here, and therefore that can sometimes bring up other factors late on during the pregnancy. So we hear often that the baby is too big. So the baby is too big, therefore the woman would need to give birth to her baby via cesarean section,
or be induced early before it grew any bigger, or that kind of thing. Yeah.
So, and it's just not always the whole picture. That's what we're saying. So sometimes, yes, this is absolutely necessary. We know this, but the cesarean section rate in the UAE is
64%,
60-something percent. I mean, that's huge, isn't it?
What's it everywhere else? Roughly,
you're looking around like 20 to 30%.
So
I've read in the, what is it called? It's not the maybe it's the World Health Organization.
World Health Organization is.
Yeah, they say that it's only necessary in 5 to 10%.
Yeah, 10%.
Is what the number should look like.
For like emergency cases.
And there's a woman in the US that called Ina May Gaskin, which we read a lot of her literature when we were learning about becoming, you know, childbirth educators and doulas, and she's built this, like, it's called The Farm, and it's basically women can come and give birth there, and her rate is something like 2%. And she's like, you know, the whole point is like, if women are given education, if they're given choices, if they're put in the right environment, you know, the lights are low, they're feeling safe, there's no fear, the adrenaline's low, the oxytocin is high, if all these factors are in place, then actually the rate should be like that, potentially like that low. She has her own.
But when she was part of the fabulous, you know, hippie convoys that were in the 60s.
She would like drive caravans around the US, and like birth people across America.
I love her.
Well, they had the community, so they had their community, and so within the community, she was the woman that assisted or helped women birth their own babies. So and even then, so I've heard her speak a couple of times of you, and she never says, you know, we don't not go to doctors, we don't not seek out medical intervention if we don't need it, but the necessity was only ever, you know, about 2 or 3%.
So if I'm the meathead driving the car down Lakeside Road,
once again,
why do we need to avoid a C-section and have a natural birth? Why? What's going on there? treat me. I mean, I can guess a couple of things, but if I don't know anything, why? What's the big issue?
I suppose. Well, it's abdominal surgery for one.
Cutting through like all 7 layers, which just takes a lot more time to heal.
So the recovery would be longer. The process would be quicker, I suppose, and in emergency situations, of course, it's absolutely necessary.
Like pre-eclampsia.
Yeah, I mean, there would be all sorts of reasons why it might be necessary because of the mother's health or the baby's health. But we could talk about the physiological process of birthing a baby for a woman and what that means to her, so that that feeling of empowerment and ownership on her body about it, what it's able to do. We could also talk about the impact that it has on the baby. So as the baby finds its way navigating through the pelvis and through the birth canal, the baby has a little bit more of adrenaline, good adrenaline at this time, in its system, and it's ready for its first sort of survival of life, ready to live. And that passage through the birth canal, we could start talking about the microbiome now.
We love absolutely. There's something that to be said about it, going through the birth canal and being, covered in all of the amazing like bacteria and the flora. That sensation of being kind of like squeezed out means all of the fluid gets pushed, out. Excess fluid from like lungs
comes out of its lungs,
pushed out. So there's benefits to the baby for that. Yeah.
And as the baby is reaching the mother's pelvic floor, that then sends messages to the brain, which then sends messages to the breasts to say the baby is now coming. So the breasts need to start, the prolactin goes and starts making milk. So it's like that whole process, that whole kind of...
And that's another thing that sometimes, not always, but sometimes when having a C-section, you might, your milk might take a little bit more time to come in, which means if you wanted to exclusively breastfeed, which again is a complete, choice, that you might have to, wait a couple of days or use formula for a few days until your milk came in, that kind of thing.
I think the whole conversation regarding women having a cesarean birth or a physiological delivery, it's just so complex now. That's the thing, because lots of other factors come into play, and we can't sit here and say this is better or
this way is the right way, this is the wrong way.
It isn't. Yeah. But I think what we do have to look at is the stats and say, right, so to look globally and look at the statistics and say, from an evolutionary process, what is going on here? Is it going to be okay for 60% of the world to be born via cesarean section?
I have a feeling though that this age we are going through a surgery craze in this last, as soon as anesthesia came along and we can now have surgery quickly and safely without any pain. I think it's a surgery craze. It is. I think that's going to taper when people start to realize that actually this physical body, there's just something else there that's very intelligent that I can't put my finger on it, but what we do to it when we cut it open like that, something goes on and we disrupt stuff that at this present moment I don't think science is there and science understands that. But that's my feeling about that.
I mean, in other countries, the cesarean section rate is much higher than that. I mean, in the UK, in parts of the UK, it's over 30% in parts of London and inner cities. And that might be to do with maternal age or all sorts of other
some places are as high as like 80%.
I mean, Brazil it's huge.
I remember watching this documentary though about this woman that was giving birth in the UK, and here predominantly when babies are breached, they C-section them, and in the UK they manually turn
ETV it's called.
That was amazing.
External. So did you see the video where they actually turned the baby?
They massage it out.
It is crazy. And so consultants, that would be performed by a consultant, so an obstetrician who has that skill to do that. So obstetricians are maybe they're unskilled, they don't have the skill, or they're being de-skilled, so they don't do it enough any longer to continue that skill.
So they can't do
it any longer, so they can't do it safely.
Exactly. So their advice would be to have a C-section because they don't feel confident enough with any other option at that point. So we have to understand that that perspective is like, actually for them, this is the safest. Like, this is the procedure that they're the most comfortable with, you know?
I was just going to go back to your, what you said about pain, about perception, the pain thing. And I had an interesting conversation recently with my dentist about pain. And I was going to have some root canal treatment done. And I'm like sitting in the chair saying, yeah, I'm probably good. I probably don't need to have any anesthetic because I have really good like coping mechanisms and and you know what's coming, don't you? And I've got I can do really good deep breathing, which I can, right? I can do this. And I've had teeth out before, and I've whatever. How wrong was I? And so, but then what we started doing was then talking about because every time she came near me I flinched, and she's like, Jane, it's going to be fine, I'll promise this bit isn't going to hurt, I promise you. And I don't know if any of you have had root canal treatment and what that really feels like. So and the lovely dental nurse was stroking my hand and massaging my hands, and I was thinking, this is a bit like being a doula. She's really making me, mopping my brow a little bit and doing that kind of thing. And then we had this conversation about pain, and then about what our perception of pain and our receptors to pain. So the emotional and physiological receptors to pain, and how in some people is that different to others. Yeah,
I think also that this day and age, don't laugh there, I think that we are very much afraid of pain, so much. We are afraid to feel it. We're afraid that it is like, it's just a natural part of life, like joy is. Like, we have to feel some form of pain, and I think these days we're very afraid of it.
Well, I think,
and so we steer away from it. And for birth, I think that is the biggest thing. Women are like, I don't want to feel any pain. Like, I don't want to go there.
Well, we're used to being given something to take it away at any point in time. We know that we don't have to deal with it. Like, oh, like I have period cramps, I'm going to take these pills. Or like, oh, like my foot hurts, I'm going to do this. So you're absolutely right. Like, we're used to it being a thing that we, the people say, oh, well, let's like help alleviate that pain. Let's take that pain away. And so we don't, our experience now is that we don't have really access to it. So we don't even know what our threshold is. And, come to birthday, how, people who are like, oh, would love to have a natural birth. It's like, well, okay, but how can you start to, re-educate yourself and your body, and what tools do you have that you can use? Because, hey, guess what? Like, you're going to feel something that's different to what you've ever felt before.
That's so true. Yeah, that is so true. But we know that, so for birth, the pain or the contractions, so the pain, lots of birth workers don't like to use the word pain, but the pain that women experience it's not an indication that something is amiss. So usually pain is a factor that's telling us there's something up, isn't it? But in childbirth, that's not the case. So the pain that women feel at the very beginning is different. So when they start their early contractions, is very different to what they feel towards the end of their contractions. And so that's an indicator of how far along in labour a woman is.
I have a question to ask you. I hope it's not too personal. You said that you had 2 births. One was at home. What was that like? Like, what was the process when you were giving birth? Did you take any medication? Because we're talking about pain now. What was that, like, that pain process, or that process in general? Maybe not pain.
See, the amazing thing about having babies is that you really do forget what that feels like. That annoying. And I think part of my childbirth education profession, we were always kind of taught never to really talk about our own experiences, because they never really have an impact on what other people go through. So that's so true, But I have to share with you on each occasion of having, so 3 births, all very different. So the first one was very quick, and when I arrived in hospital, I was absolutely screaming for an epidural. And my husband was saying, yeah, but you said, that smug, you said you didn't want any pain relief. And I'm like, get me the epidural. And then I think I'm going to push. And then actually I was too far advanced. So it was a really quick first birth, which would say probably be more unusual. So actually I had a really amazing German midwife called Ingrid. So you never forget your midwives. You never forget the people who were there and the things that they said at that time. And she was so amazing. And I just remember her saying, right, let's turn over. Let's get into a different position. You might be comfortable. She hadn't even got time to put change. She was in her genes. And so that was a specific, and then afterwards I felt absolutely incredible because he was, I felt amazing, that a huge endorphin and hormonal rush afterwards was just incredible.
So you didn't have an epidural for the first one?
No, there was no time. I remember the anaesthetist coming and saying, you're 10 you're fully dilated, so there's just no time for this. And I do remember feeling disappointed that I couldn't get the pain relief that I needed at the time. But once she started supporting me in a real true fashion, I felt okay and I felt safe again. And then my second baby, Harvey, was born at home, and he was in a posterior lie, so back to back. So the baby has to enter the pelvis a different way, and it takes a longer time to rotate through the pelvis. So women often report of backache labour at that point. And he was just long and slow, and I just went on and on and on and on and on. But also another amazing midwife there who was there massaging my back, so that real cranial sacrum, not cranial, wrong end, sacral massage was amazing. But with Dylan, so my final birth, I remember thinking that
keep going, that's all right.
I remember thinking that when the midwife gets here, I know if she tells me I'm only 1 or 2 centimeters, I know she has got drugs in that bag that I can have. So I did feel that was really quite intense. And I remember when I gave birth to him, can I swear?
Yeah.
And I said, oh fuck, I really am not ever doing that again. So I think it still at that time, even though I had done it twice before, that memory and that feeling of being so overwhelmed with the contractions is something that I think you will never ever experience before.
So you did 3 naturally no pain
medication. And I was saying not no pain, but but there is some suggestion that so when we perceive pain, when we process pain, we then our endorphins kick in too, don't they? So that's our body's own pain relieving mechanism. So if we give massively that chance to take massage, it makes that, it's good. That's the
and
thing,
like it works. Like I know I say this a lot too. Sorry, I'm going back to my accident. But when I fell, I remember laying there and not like being in pain, but just breathing because I knew I was really messed up, and breathing. And now in hindsight, when I look back, I was like, man, this body's amazing. Like whatever drugs it was releasing to keep me awake and lucid, like.
And that's what we try to remind women, that yes, even though it is going to be, you're going to be feeling pain, that there's actually all these other things happening in the background, like all the hormones that are happening to help you through that process. Whereas if you walk into a chair and stub your toe, that's a different kind of pain. You didn't have anything else. You didn't have this hormone cocktail working in your favor.
But you could, if you stubbed your toe. If you started rubbing that stubbed toe,
yes,
you then create some endorphin.
Yes, true.
You see, so that's the same. We do use that analogy sometimes.
Yes.
So that's true.
Yeah.
As a kind of take-home message, what are the things that ladies need to know? Like, what's the main categories that people need to consider that they may not be thinking?
You have a choice.
You have choices.
Yeah.
So you have choice on who your care provider is.
Mm-hmm.
So
you can change your doctor last minute if you wanted to.
So if your care provider, your doctor here specifically, is not, singing from the same hymn sheet as you, then you can change.
Mm-hmm.
Yeah. So
evidence-based research. So there's a website called evidencebasedbirth.com, and she's done like statistical clinical research
on pretty much everything.
Like using like water for your birth, using an epidural, which labor position is statistically shown to be the best for XYZ. So her website's amazing. So we always say go and be educated, be informed.
What's the website again?
Evidencebasedbirth.com, and she has a podcast as well.
Yes, great.
She releases one almost every week that talks about a different topic.
Yeah. So be educated. I think surround yourself by positive people is always good. Mm-hmm. But just have a really good understanding of what you want to happen on the day. And that's, I think, when we talk about birth plans, birth preferences.
Yeah.
We now talk about birth preferences, about ideally how would you like things to go. So have a vision about what you'd like to happen on the day, and then saying that out loud and writing it down with your partner gives you both an insight into how that could be achievable, and so how can we go about getting what we've got on the paper, I think is really important.
Looking at everyone focuses a lot on the birth, and we have talked about the birth a lot, but something that we always say to take home is, that's one day for the rest of your life, what have you thought about what's coming next? Like, have you thought about what's it going to feel like to have this new thing in your house? And what about your relationship? You know, it was like this two-way street, and now it's this, you know, triangle. And, you know, thinking about that, bathing, sleeping, feeding.
I mean, that's a whole other subject.
Well, do you know what I was, as I was sitting here, I'm going to be really honest, I was thinking, will you guys come back? Can we talk about that next?
Yes.
Yeah. Oh, well, certainly the postnatal stuff is really, really important. I mean, that's really where my passion lies, absolutely. And it's so important. And
so you guys will come back to talk about that?
I'll be back.
No, that's fine. Also, and we won't do it next, we're a little bit pressed for time, what the guys need to know.
Yes.
We can go through that as well.
Yeah, we'd love to do a guy special.
Yeah, because I can drive, but after that, I can carry bags and boxes and stuff. After that, I don't know.
It's all about the tools. So we give the woman the tools, and we also make sure that the partner has the tools as well. Like, here's how you can support her. Here's how you can massage her. Here's how you can reassure her. Here's how you can step in. Here's how you can care for her and the baby, you know. And then it's like, you know, here's how you can sleep, and she's going to do this, and then she's going to sleep, and then you're going to do this. And it's very much including everybody in that process.
Perfect. Sounds good.
Amazing.
Thank you guys so much.
Where can people catch up with you guys online, or what's your
littlefeathercollective.com or Little Feather Collective on Instagram.
And you guys have a whole load of doulas that can go out and support people if they
we
need
do.
it.
We're a group of 6 women, and we do everything from sleep to
loss,
multiples,
baby massage,
breastfeeding,
hypnobirthing,
yoga. So we have, like, between us just a whole set of skills, and we have different services, and get in touch.
Yeah,
awesome.
amazing.
Thank you guys.
Thank you so much for having us.
Thanks, guys. Bye.